Okay, we're gonna show you how to do a little muscle work on the neck and trapezius muscles of your partner at home. This is gonna be if they're complaining of tightness through their neck or stiffness in their neck, coming down into these muscles or coming down by the shoulder blade down here. Quick disclaimer, if they're having pain radiating down into their hands or arm, or this has been really, really painful, like severe pain, and it's persisting, don't do this. You gotta have them get checked first and make sure that we don't have a disc injury or some nerve impingement going on that's causing this. So if you don't have a bunch of referral going on, then this is okay to do at home, okay? So a couple different angles we're gonna work. Ashley's holding the muscle cream for me. I'm gonna just grab a little squirt of muscle cream. And you can at home, if you have muscle cream, great. If you just have hand lotion, just use hand lotion. We just really want something to make it slippery. So I'm gonna start. There's different muscles and different muscle attachments on here. So we're gonna run a line on the first angle from the back of her head just to the right of her spine down to the inside of the shoulder blade. The corner of Ashley's shoulder blade's right there. So I'm gonna come just inside of it, all the way down to here. Okay, so we're gonna just rub this on a little bit. Okay, so Ashley's gonna bring her head straight. I'm gonna have her turn her nose to her left knee. And then as she tilts down, I'm gonna use my thumbs and come right down here to the inside of that blade. And you can see with my thumbs, they're blanching. I'm putting enough pressure there that they're going white. Okay, bring your head up, Ashley. As she comes up, I go up. And we're gonna go right back to the back of her skull again, right where the neck meets the skull. Okay, look down, right on down. Now, you just communicate with them, just make sure you're not pushing too hard. Am I pushing too hard, Ashley? Is that comfortable?
No, that's good.
Okay, bring your head back up. Good. Husbands, if you're doing this to your wife, and they're saying you're pushing too hard, listen to them, lighten up. Don't say suck it up and go harder. You've got to just, I mean, this can be really painful. So be light. Go down. I'm going to come down to the inside of that shoulder blade and back up. So that's the first angle. Do that about 3 times. Then we're going to work out a little farther along this trapezius muscle out here. So Ashley's going to turn her nose to her opposite hip. And then she's just gonna be going up and down at that angle, okay? I'm gonna start up here again, slightly farther over to the right. And then as she looks down, I'm gonna come more down along here. And she's got a big knot right there. That's a common knot spot on people. And I go right out to the bone of the shoulder right here. Okay, Ashley, bring your head back up. We're gonna come right back up to the bone at the top of her neck there, and then look down, and down again. We're gonna do that 3 times. Bring your head up, good, and then down. This is a type of active release. So you have them actively moving while you strip and release the muscle. Okay, and then right back up. Good. Okay, so sometimes when I find a knot like that, I'll just get on there and with my thumb just do tight circles and just work that for a sec. Ashley works at a computer all day, and so this is really, really common with people who are at computers all day because your shoulders are slightly shrugged, your arms are forward, this muscle just gets tight. Okay, good, last angle. Give me a little more muscle cream, Ashley, so I don't skin burn you. Good, last angle. She's gonna keep her head straight and tilt straight across. I'm gonna come from just behind her ear, right down. You can just follow that muscle that's popping out all the way down to here, okay? Just rub that in. Okay, Ashley, so I'm gonna come down because your head's tilted. I'm gonna come right down to the bone of the shoulder, and then as you bring your head up, Ash, I'm gonna come up. Okay, now as you're working over here, you've got some pretty sensitive tissue over here. Tilt to the left. So this one I lighten up. I don't go nearly as hard, especially right through here. You don't wanna be pushing super hard. Okay, come on up. As I come up, I lighten it up and just let my thumbs run right up behind the ear. There's a bone right behind that ear. Okay, tilt over and down, and then bring your head up. Good. This area of your neck really commonly refers pain to the temporal area of your head, so it's a common cause of headaches right above your ear, up in there. Back here, where we first started, is a common area to refer up to the forehead behind the ear. So if you get a lot of tension headaches, this is awesome to have someone do to you. They'll earn big brownie points. Okay, so again, first angle, she's gonna turn to her nose to her opposite hip and look down, and I'm gonna come down just inside the shoulder blade. Bring your head back up. Now she's gonna turn to her hip, and I'm gonna come out to the shoulder bone, way out here, and then back up. And then last one, she's gonna look straight, tilt straight across, and I'm gonna follow that muscle right down to the shoulder bone. Okay? Good, you only need to do about 3 or 4 strips on each angle to be effective. You don't have to spend an hour on this. Okay, that feel all right, Ashley?
Yeah, feels good.
And then you do it on the opposite side, okay? Always do the opposite side so you're keeping them even. All right.